Hello everyone. Today we are going through the topic of pathology and lab. I will discuss the key concept and go through some examples. My channel is all about health information management, health information technology, medical coding and billing. If you are new to this channel, please like and subscribe. All right, let's get started. Pathology and lab. Pathology and lab codes. These codes describe procedure or services that are performed by the physicians or by the medical technologist under the direct supervision of a physician. The procedure include various lab tests such as urinalysis and blood work, as well as the pathological examination such as frozen sections and the pap smear. Qualitative testing. It determines whether or not the element is present in the specimen, which provides results as positive or negative. Quantitative testing, it provides the amount of certain elements in the specimen, and the results are numeric values. Reflex testing, it means that the performance of the subsequent test is dependent upon the result value of the initial test. For example, when the result of a culture is positive, the positive result triggers one or more additional tests, also called the reflex testing. If the culture had been negative, no further testing would take place. Clinical Laboratory Improvement Amendment (CLIA). Laboratory needs to be inspected by CLIA once every 2 years. In order to perform tests and to bill for them, lab must be CLIA certified or obtain a waiver. For small lab tests that perform only the basic testing, such as urine dipstick, finger stick glucose test, pregnancy test, waiver may be obtained. So they can be CLIA certified or waiver. The list of tests approved for waived laboratories is updated on a periodic basis. To obtain a listing of the tests that are currently considered waived or the administrative rules of the Clinical Laboratory Improvement Act, consult the Food and Drug Administration (FDA) website or the Centers for Medicare and Medicaid Services (CMS) website. So you can go to the website and find the list of waived lab tests. When reporting codes for the waived procedure that are performed by a waived laboratory, QW modifier must be attached to the CPT code to obtain payment from the Medicare or Medicaid. So we can also remember the modifier for the waived test is QW, Q for CLIA and W for waived. We can even remember in this way. Microbiology. It is the culturing of microbiology is the culturing of microorganisms and their identification. These organisms can be classified as bacteria, viruses, fungi, and molds or parasites. These microorganisms are also tested against the drugs to determine their sensitivity to specific drugs and specific strength of those drugs, also called susceptibility testing. Negative culture can frequently be coded with one CPT code. When culture is positive and the physician has ordered reflex testing, multiple layers of coding are necessary to fully describe all the services ordered and provided. Immunology. It is used for specific laboratory tests to access the patient immune system or the presence of antigen and antibody with a specimen. Organ or disease-oriented panel. If all tests in the panel are not performed, each test completed should be coded separately. If additional tests beyond those listed in the panel are performed, they should be coded separately in addition to the code for the panel. Modifier 90, which is used for the reference laboratory. It indicates that the physician does not perform the actual test or services, but instead sends specimen to the outside laboratory. 91, which is used for repeat clinical diagnostic lab test. Modified 91 is used for lab tests performed more than once on the same day on the same patient. This modifier may not be used when tests are rerun either to confirm initial result because of testing problem with specimen or equipment or for any other reasons when a normal one-time reportable results is all that is required. 92, which is used for alternative laboratory platform testing. When laboratory testing is being performed using a kit or transportable instrument that wholly or in part consists of a single-use, disposable analytical chamber, the service may be identified by adding modifier 92 to the usual laboratory procedure code. So in this testing, um, test doesn't when modifier is used, test doesn't require permanent space. It can be handheld and carried to the patient for immediate testing. QW is the CLIA web test. Let's go through some examples. Gross and pathologic examination for a fallopian tube biopsy. And here are some options. Each option has description with the important points that are being highlighted. So the first one, option A, is fallopian tube. The highlighted part is fallopian tube biopsy. Option B has a fallopian tube, which is a ligation. Option C has fallopian tube, which is sterilization. And option D has laparoscopy biopsy. So among these, first option matches the question, that is the fallopian tube biopsy. Next question is evaluation of blood gases pH, PCO2, PO2, CO2 and SCO3, and here are the options and these are the description. So option A has pH, PCO2, PO2, CO2, SCO3, this which matches to our question, and option B has oxygen saturation only, and option C has pH only, option D has PO2. So B, C, and D doesn't match to our question. So the answer is option A. Gases, blood, any combination of pH, PCO2, PO2, CO2, SCO3. Next question is the pathologist completes a frozen section exam by making 2 tissue blocks from a specimen labeled right kidney and 1 tissue block from a specimen labeled right ureter. How is this service coded? So here are the description. It looks a lot. So option A has first tissue block, and that is a single specimen and the additional tissue block, which kind of matches to our question. And the option B has gross and microscopic examination as well in the option, which and our question doesn't say anything about that, so we will just ignore this option B. And option C also has uh, um, the gross and microscopic examination, so we will ignore this option too. And option D has first tissue block, single specimen with that match, but it doesn't say anything about this next option, next tissue block. So our answer should be option A because it talks about the uh, first tissue block single specimen, that is times 2, and then additional tissue block, that is the third one, which is for the right ureter. So option A is the answer. Next question is, which of the following is the correct code assignment for fecal occult blood test? Patient provided with 3 cars for consecutive collection. So here are the options and these are the description of the code. So first, uh, option A has feces. The highlighted part is feces. Patient provided 3 cars or single triple car for consecutive collection, which kind of match to our question. And option B has blood occult and it says other sources. It doesn't match to our question. And option C has feces, and it just it doesn't, and rest of the, there is one highlighted part, I mean it doesn't match to our question. And option D has feces 1 2 3 simultaneous determination. This doesn't match to our question. So our answer is option A. um, Blood occurred by peroxidase activity qualitative feces, consecutive collected specimens with single determination. For colorectal neoplasm screening, patient was provided 3 cards or single triple card for consecutive collection. So this option A is the answer. Next question is, a pap smear slide is read using automated screening and manual rescreening under physician supervision. How is this coded? So here are the options, and these are the description of the option. Um, we can check the highlighted part to make sure it matches to our question. The first option is manual screening. I mean, first in the first option, we can see the highlighted part is manual screening under physician supervision. So it only talks about the manual. It doesn't talk about the automated screening as well. So the first option we will just ignore now. And section option B is automated system under physician supervision. Again, this talks only about the automated part, not the manual one. C talks about automated system with manual rescreening. It matches to our question. And option D is screening by automated, only by the automated. So according to our option C is the right answer, which talks about automated system with manual rescreening under physician supervision. And that matches to our questions. Thank you for watching this video. Please like and subscribe, and I will see you guys in the next video.